Two of the items we plan to discuss on this episode were the U.S. school situation and the reaction to the recent op-ed you wrote in the New York Times with Minneapolis Federal Reserve Bank President Neil Kashkari. Fortunately, we have a listener email that combines both of those topics, so I'm just going to go with that. Dan writes, I read the New York Times op-ed you co-wrote regarding a 6-week lockdown. I've also listened to your podcast in late July regarding reopening schools with the mantra of flexibility. I'm wondering if you would advocate delaying school for 6 weeks as well if we were to lock down and then reopening with a flexible approach.
Well, thank you, Dan. And thank you to all of you who continue to send in questions. I want to emphasize, and the CIDRAP staff are participating in this podcast here, so they can be my sworn confidants in this issue. But we read all of your emails. We read them all. And I try to respond back to as many as I possibly can. It's getting tough right now, given the number, but please don't stop sending them. And Dan, it's very thoughtful questions like this that are really helpful for us to think about what should we be thinking about. Let me kind of break this into two parts and then bring them back together. The first thing is on the school issue. We're going to talk in a moment about college campuses, but, unfortunately, everything's unfolding pretty much as we've said about young adults and adolescents. High schools around the country are experiencing real challenging problems. And I do think that we could have a much better shot at opening these schools for in-campus learning experiences if, in fact, we weren't seeing the kinds of transmission levels we're seeing. But I don't see us anytime soon decreasing those levels. So that's a challenge. I still am hopeful for elementary schools in a number of locations. As I've shared with you in the past, there's something very different about younger kids. I just keep reminding you that here in Minnesota, we've had our daycare facilities open all summer, with local public health, state public health supporting them. We have not had any outbreaks. There have been some introductions of the virus by adults into daycare, and we just have not seen the problems, however, emerge. So there's something special there. But when you're talking about adolescents and young adults, that also is a social, cultural experience where it's not about the virus. It's not about even their physiology of, being in adolescents or young adults. It's their behavior. And, if I could right now, I would invent the most wonderful behavior pill where everybody took it once a day, and it basically reduced all their high-risk behavior. And one of the serious side effects of it was they had an incredible outpouring of kindness. Wouldn't that be a great pill? So bottom line is that doesn't exist. So we have to accept the fact that I think we're going to have a real challenge with high schools and colleges, universities ongoing. I don't see anything changing there in the near term. Now, theoretically, if we could have a quote-unquote lockdown or whatever someone wants to call it in such a way that makes it more palatable, I'm convinced that would have a major impact. And I have to tell you, all the feedback I got since that op-ed piece, which has been substantial, really is divided into two camps. One who understand what we were trying to say and were very, very supportive. And for those, thank you. The last thing we want to do is harm anyone any more than this virus is doing, God knows. But there are others of you that saw this as just a further intrusion. We were just going to pile it on. The virus might hit you first if you were worried about it at all, but then we just piled on. Let me just point out that, again, the whole purpose of that op-ed was to lay out a plan that minimized the pain and suffering and economic disruption. The Federal Reserve Bank researchers are among the best in the world, have determined that, in fact, it's going to be this bleeding day after day after day by these increasing numbers that will bring down the economy. And, we actually have data from Europe where even though they're having an increase in cases right now, they have still opened up much, much more than us. And if you actually look at a graph showing the changes in visits to retail and recreation locations from February to August for the United States, France, Italy, and Germany, you can see we were all at the same in February, and then making that kind of the zero level. You can see over an 80% decrease in visits to those locations for both France and Italy, Germany slightly higher. The United States never got down below 40%. Well, we stayed down there and then kind of gradually came up. And guess what happened? Germany, France, and Italy, by end of July, had come back up and had far surpassed us. They'd recovered in a way that we haven't because they did it right. And in fact, in an op-ed piece that John Barry, a dear friend and author of the great influenza book, it has today in the New York Times, is very, very important. It addresses the issue of what happened to the European economy and how it's recovered better than we have. They actually looked at unemployment right now. It's at 6.4% in those countries. The United States rate is 10.2%. And in March and April, according to Open Table, the reservation booking company, business and restaurants in Germany and the U.S. were in identical places, down over 90% year over year. So remember, this is in March and April. Since then, they've diverged widely. Data for August 16th, the latest data which is available, shows German restaurants now enjoyed a 9% more business than last year. Let me repeat that, more business than last year before the pandemic, while the United States restaurants are still down 50%. That's what we were talking about, is driving down this virus to the point of where we could control it enough to not only save lives and illnesses, but also to help bring business back. This was not an anti-business op-ed. And I also emphasize that, the Federal Reserve Bank, looking at how we've gone from a 2% of our income savings to 8%, we could finance supporting all the people who are losing their jobs, small businesses to keep them whole, city and state governments, with just the savings that has occurred since this pandemic began. We would not have any need for foreign dollars. So I just want to come back and say that I hope we still consider it. I've watched one more week. New York has been flat. No increase in cases, despite being surrounded by cases, despite the fact people are coming into New York with cases. The deaths, again, at an all-time low. That, to me, is remarkable. Now, they're not back to normal. Those of you living in New York know New York City is still not the city it once was. But you know what's really different? During the time of April, I was haunted by the fact every time I talked to somebody from New York, and I had many calls a day with people there, all I ever heard in the background were sirens. Day in and day out, 24/7. You don't hear any sirens there today. And I think that we still have an opportunity to learn this lesson. I won't give up. Maybe that's why I'm an English Channel swimmer. There's a piece missing up on top. But the bottom line is that I still think we have an opportunity here. But it's going to have to be a state-by-state issue. I don't believe there will be a national lockdown. There doesn't need to be, frankly. Some states can do it much easier and much better than others. Some localities within states are much further along in doing this. But I think at this point, the key message is that, Dan, you're right. If we could do a lockdown for 6 weeks, I think if we could postpone our schools, we'd have a much, much better chance at actually opening them, having students coming to class, not just dialing in or getting on the internet. And that's my hope, and I'm not going to give up on this. And we'll have to see where we go.